Thank you. I think it's really disappointing that the Secretary of State for Health has decided to announce this apparent pay rise via the media, as opposed to actually putting the meat on the bones of the contract that he is saying that is actually going to be out there, and offering that to the BMA so that it actually can be analysed. All the previous contracts that have been offered to the BMA have actually unravelled. My view at the moment, from what I've read and heard and seen, is that at best it's exactly the same contract that has always been on the table, and at worst it is actually a worse contract, which, so as far as I'm concerned, I don't believe it to be a pay rise. The one thing I would like to comment upon is that the Secretary of State for Health is making this about pay, and it really isn't about pay. It's very difficult to say how many hours I work for a week, because as an average based over a year, I probably work about 56 hours a week. However, on some weeks I can actually work anything up to 90 to 100 hours a week.
And what impact?
I think that you have to remember that a junior doctor, a senior doctor, any health professional that enters into a caring business does not actually expect to work a 9 to 5 working pattern. All of us work unsocial hours. We work nights, we work weekends, and we work evenings. And I think we take that absolutely as part of our vocation. So obviously, I would much prefer to not have to work weekends and nights, etc. But I also recognise that it's incredibly important for me to be doing those hours, because as the Secretary of State for Health says, the NHS does need to be 24/7. And we do need to provide care when patients actually need it. And following on from that, I think there is no junior doctor or senior doctor that would disagree with that. However, the current rhetoric that we have in terms of the mortality data that the Secretary of State for Health keeps quoting is actually being misrepresented. And we know that to be true. The medical director of NHS England, Sir Bruce Keogh, has actually said to say that these deaths would be avoidable would be rash and misleading. To follow that further, if you do want 24/7 services within the NHS, which we do, what we actually need to do is not only expand our diagnostic services, but increase the amount of social and support care that we have, not only within the hospital, but also within the community. And this requires financial investment. It does not require more doctors on the floor, because already the emergency service that you have Monday to Sunday is identical. The emergency service, the number of doctors that you have on a Monday for an emergency service is exactly the same that you have on a Friday, Saturday, Sunday, Monday.
What's it like?
So I think no doctor wishes to strike. Unfortunately, the Secretary of State for Health has pushed the BMA and 53,000 junior doctors into a corner. My message to the Secretary of State for Health is that if you wish to avert a strike, there is a way. And the way is, come to the negotiation table. As you say that your door is open, our door is open, but come to the negotiation table without any preconditions so that we can have some meaningful negotiations about the junior contract. This is an opportunity to avert a strike. It's a good story.
Yeah, it's very good.